Guess what's the relationship between cooking, remote control, and cancer? Is that a new joke? Let's see. The relationship or the common factor is the magnetic nanoparticles. The word magnetic generally describes metal particles that respond to external magnetic field as nickel, cobalt, manganese, iron metals, and zero oxides. Nanoparticles definition refers to nanometer-sized particles. Magnetic nanoparticles are used for several biomedical applications, such as magnetic resonance imaging (MRI), drug delivery, and hyperthermia. Here, as we see, the surface functionalized magnetic nanoparticles are used for either targeting, diagnosis, or therapy of cancer. Herein, surface functionalization means the addition of specific moieties to perform a specific function as A. Cytotoxic agent like chemotherapy, B. Targeting agent which is either a ligand designed to reach an overexpressed receptor on cancer cell, or monoclonal antibody targeting an antigen on cancer cell. C. Fluorophore, which is a fluorescent material used for imaging process. D. Polymer coating used to protect the nanosystem from immunogenic attack with many other physical advantages. So, what does cooking mean? Cooking refers to a process called hyperthermia. This process involves the application of an alternating magnetic field into tumor-injected magnetic nanoparticles, resulting in heat generation within cancer cell enough to cause their lysis. The resulting heat also serves to form perforations within the outer shell of nanosystem, which creates controlled release manner. As we see here, the controlled release. This figure summarizes what hyperthermia is. As we see to the left, there is a drug-loaded polymer-coated magnetic nanoparticle injected into tumor inside the rat. Then, an alternating magnetic field is applied, producing heat. The resulting heat performs two functions. The first, cooking cancer cells causing their lysis. The second is to create perforations within the polymeric coat, leading to controlled release of chemotherapy like cisplatin. So, what is remote control process? Traditional chemotherapeutic agents affect both cancer and normal cells, especially those with rapid division rate, as hair, nails, alimentary tract, and bone marrow. The aim of targeted drug delivery is to provide safety, lower dosage, stability, and longer action of chemotherapeutic agents to decrease possible side effects. There are multiple targeting methods as passive targeting, external magnetic field guidance, and ligand-mediated endocytosis. The first, passive targeting or enhanced permeability and retention, depends on the angiogenesis process of tumor itself. As the tumor continues to develop and form larger masses, its needs for more nutrients increases, so it sends signals to the nearby blood vessel to perform a branch of blood vessel to enrich the tumor with food. Interestingly, the newly formed branch of blood vessel contains endothelial cells with large pores, allowing passage of more and more nutrients. Furthermore, cancer cells are characterized by poor lymphatic drainage, allowing the drug molecules to retain as much time as possible. The second targeted method is external magnetic field guidance. Herein, magnetic nanoparticles are driven into the body after injection and moved to the target tissue by the force of an external magnetic field. And after performing their function, larger particles are eliminated through liver and spleen, while smaller particles are eliminated through kidneys. The third targeting method is receptor-mediated endocytosis and often called active targeting. This process depends on conjugating magnetic nanoparticles as well as a drug to an active targeting moiety as ligand or monoclonal antibody designed to fit in an overexpressed receptor on cancer cells that is not or less expressed onto the surface of cancer cells. And now we know that magnetic nanoparticles are designed for drug or heat delivery for managing different types of tumors, and more commonly glioma, breast cancer, and ovarian cancer. Here are our references. And thanks for watching.